Muted.
Today at the Capitol prep call for the Oregon Primary Association. My name's Carly Hood. I'm a policy associate helping coordinate our day at the Capitol. And in the room, I have the rest of the policy team with me, Laura Etherton and Rick Labrowski. So we're going to go ahead and get started.
Okay, so just a few housekeeping items before we get started on the webinar. Just to let you all know, we're going to mute you during the presentation, but there will be time at the end of it for Q&A. But if you do have questions during the presentation, feel free to write them in the chat box, and we can address them either at the end or during the webinar. And just so you know, to mute or unmute yourself, there's a function. You'll see a little box, your GoToMeeting box. There's a little microphone where you can either mute or unmute yourself, or if you're calling in, press *6. Same deal, it will mute or unmute you. And then if you're having any trouble hearing us, one of the best first options is either to hang up or log off and then rejoin. Sometimes it's a matter of selecting a different listening option. You'll have a choice between either phone or voice over IP. So sometimes that will make a difference for you. Also, feel free to chat us in the chat box if you're having issues, and we'll try and help you. And then there is a website you can visit on Citrix that can help you. And just so everybody knows, we're recording this so we can send it out to folks who weren't able to make it, or if you want to revisit anything covered during this webinar. And with that, I'll hand it over to Carly.
Okay. All right. Thanks, Ursula. So today what we're hoping to do is kind of walk through in the next, I'd say 40 minutes. We want to leave plenty of time for you to ask questions and feel comfortable with what we've planned for the 21st. But we'll walk through the goals and the agenda for the day. We'll kind of touch on the key issues and priorities that we want to discuss with legislators. I'll share kind of what we've prepared on the OPCA side and we'll bring with us, and then what you can do to prepare yourselves as well. And then I'll touch on a few logistics towards the end, and again, plenty of time for you to ask questions. So our goals for the day at the Capitol are threefold. We really want to spend time educating policymakers on two key issues that Laura will cover in a moment, but really focused on the importance of Medicaid and expanding health insurance coverage for all children. We want to share the impact and the amazing work that folks are doing at community health centers across the state and what that means for the people in our state. And then lastly, we want to connect with policymakers to strengthen those relationships and to thank them for supporting community health centers where possible. So the day is still kind of taking shape. We're in the process of continuing to schedule legislative meetings and identify policymakers to speak during our morning and lunch hours. But I kind of just wanted to share this brief outline so that you could see what to expect and ask questions about this to clarify. So we'll start 8 to 8:15. If you can arrive around 8, we'll have breakfast available in the room. We'll be in room 350, which is on the 3rd floor of the Capitol building in Salem. Again, this is March 21st, Tuesday, March 21st. So we'll have breakfast. Folks can kind of get settled, check in, and then at 8:15 we'll start with sort of a presentation of the day, overview of what's to be expected from OPCA staff and John and Cassie at Eames Consulting. From 8:30 to 9, we'll have some combination of policymakers that we've invited to come speak and or a little bit more prep so that you feel ready to dive right into the conversations with legislators at 9. And we're solidifying the speakers that we'll have currently. And then from 9 to essentially 4:45, we've scheduled about 30 legislative meetings with representatives and senators in your regions. And those will take place sporadically throughout the day. We'll have a schedule for you so you'll be very clear on who you're meeting with and when you're meant to meet with them and where that will be. But for the times that you aren't meeting with a legislator, we have the room all day, so you should feel free to come and go. We'll have some activities set up for you, opportunities to engage with one another, engage with OPCA staff. And then there are a couple of events that are happening at the Capitol that day. If there are any Senate or House floor sessions, those occur at 11 in the morning, and you can watch from the third floor balcony. That's sometimes a fun educational activity if you're not visiting with a legislator. And then from 1 to 2:45, our Senate Healthcare Committee meets Tuesdays and Thursdays throughout the session. So that's another opportunity to sit in and kind of hear what's being brought to the committee. Lunch will be at noon, and again, we've kind of scheduled some policymakers to come speak to us for that noon hour. There will be snacks in the afternoon, so if you're feeling like you need a boost of energy, which you might, come back to the room. And then we'll try to do wrap up and kind of touch on some aha moments or high moments at the end of the day from 4:30 to 5.
Great. We are really looking forward to this day coming up. This is Laura Etherton. I want to talk a little bit about some of the main focus areas with lawmakers in those individual meetings. Or I guess if you run into them randomly in the elevator is another place where you might have a good conversation. But normally it will be in the meetings. It might just be you and your legislator and folks from your health center. It may be a couple different health centers who all have clinic locations in that legislator's district. And we can tell the story about what's happening in the district, who we're serving, where those clinic sites are. So there's sort of three main areas that we think will be really helpful to include in the meeting. One is potentially the most important part is really just educating and answering questions and reminding lawmakers what community health centers are. Community health centers are local nonprofits and public entities that deliver integrated primary care in rural and underserved areas across the state. Altogether, health centers serve over 400,000 patients in Oregon. And we will have, and then you can focus on how many, roughly how many patients are served in that legislator's districts. We are creating district by district fact sheets that list the approximate number of patients in that are served by clinics in that district, so we can include those impressive numbers there. This is also a great place to talk a little bit about where your clinic locations are, a little bit about the types of services you do, what CCOs you work with, and really big highlights. What percentage of, how are you doing on quality metrics? What areas are you innovating in and are really proud of? So just that education and connection with that policymaker to understand how critical you are in their district. The second really key piece we want to focus on, and this is our top priority in terms of the legislative session, is protecting the Oregon health plan from budget cuts. The Oregon is facing a large budget shortfall, about $1.6 billion, and that is large, and a lot of that shortfall falls within the healthcare component of the budget. Not because really of rising costs, but because there are fewer, it's a slow ramping down of federal resources. And so that is a really key part, and health centers have a really critical role to play in telling the story of what's at stake and why it's so important to not have any cuts to coverage, to eligibility, and that we protect the ability of health centers to serve patients on the Oregon Health Plan. The key facts that you'll want to include here include the number of community health center, or the percentage of community health center patients in that lawmaker's district that are on the Oregon Health Plan. That's another key factoid that will be on that district fact sheet. On average, it's about 59% of community health centers patients that are on the Oregon Health Plan, and so that's way more than half. It's the largest group, But in each district it varies. You know, in some places there's more Medicare or more private coverage or more uninsured. So that's the mix there, and that we'll have a pie chart that shows all of those pieces for the health centers in the district right there on that fact sheet. And this is a place where I think this is, in this section is really the core place to tell stories about really the difference that you're making for consumers and patients in your district. How you see firsthand every day how coverage is important for patients. This is a great place to talk about stories that about how patients went from being uninsured to having insurance when the Oregon Health Plan was expanded under ACA expansion. Examples of how that coverage meant better care for folks and, you know, potentially lower costs to help them get healthier. I know that I've seen a lot of great stories that you all have sent in relation largely to the federal debate going on, but those same stories work here because it's those very patients that are most at risk of losing coverage if Oregon doesn't fill that budget shortfall. And then the third talking point, or the third key issue that we're focusing on is supporting Cover All Kids. This is really a natural outflow from the work to protect the Oregon Health Plan, telling a story about how the Oregon Health Plan has been important for our patients, and then just extending it to say, this is really important coverage, and every child in Oregon should have health, you know, coverage under the Oregon Health Plan. So we're asking lawmakers to support covering all kids, this is a nice place to explain to them too a little bit about the health center mission to serve Oregonians regardless of their insurance status or their ability to pay, but making the connection that while we're able to do that and health centers have that as part of the mission, it is always best for children to have coverage so they can, just like any other kid, can access the full range of services such as hospital services, specialty services, and that health centers, because health centers are a key part of coordinated care organizations, can continue to care for kids as they go from being uninsured to being covered. So that's a good piece, and then we'll have some thank yous in this area. This is a bill that has a lot of bipartisan support in the legislature, and we'll also have some key thank yous for lawmakers who voted this week in favor of these bills in the House Committee and the Senate Committee on Health Care. Those are small committees, so it won't be that many people, but we'll have some nice thank yous for sponsors of the bill and for people who voted for it just yesterday and the day before yesterday. So big victories there. There are a number of other policy priorities and bills that OPCA is supporting and tracking. One of the pieces that we'll have at the event is just our full list of policy priorities that includes engaging in the conversation around the future of CCOs, the importance of investing in primary care and prevention to lower system-wide costs, and the importance of ensuring Oregonians have access to affordable housing, because of course, affordable, housing and health go hand in hand. So those are a couple of the key other areas that are that may come up in the meeting, and we have that policy priority longer list. But it's always easier to focus on just a couple of things, and these are two of the things that are really active conversations in the session, so they'll be really relevant. So I think those are the key pieces here, and then I think the other kind of couple tips, and we'll go over this at the day of as well, is oftentimes lawmakers might ask a question about something specifically about your health center or the clinic in their district. They might ask of a very specific piece that you may or may not know the answer to, and it can be sort of flustering in the moment if you feel like, oh, I don't really know that answer. Or they might ask a question about what our position we have on a bill that you haven't heard of before. And I really look at those examples as opportunities. So if a lawmaker asks a question and you don't know the answer right away, you have now an excellent excuse to talk to them later and give them that answer. So if you don't know the answer, it's always fine to say, I don't know, and that's a really good question. Let me get back to you on that. And then looping us in, we can help put together an answer or get that the information, and it's a wonderful way to follow up with them and get them that answer, and that is actually one of the best ways to build a relationship. So I just wanted to note that you don't have to be an expert on anything except your own actual areas of expertise, and anything that comes up just can help build that relationship even more. So that's all I've got. Do we want to jump on to what OPCA is? Yeah, perfect.
Yeah, thanks, Laura. So we will bring, and in just a moment we'll unmute so you guys can ask questions about the talking points as well, but we plan to bring the agenda day of that'll be clear and consistent, everything kind of hammered out a bit more. We'll bring the legislative meeting schedule so you'll, again, be able to identify who you're meeting with, where that is, and OPCA will have a team lead for the meeting. We'll be able to go over a bit more day of kind of what that meeting structure will look like, but you won't be flying solo. You'll have someone there from OPCA who can help kind of introduce you and guide the conversation. We're preparing packets for each legislator, which includes a large overarching Oregon Community Health Center fact sheet and data based on all of the health centers that you work in, district level fact sheets for your particular district, and then our policy priorities Laura mentioned. We'll have talking points and a meeting outline. Again, we'll walk through that day of so you feel comfortable. We're also putting together a list of legislative members so that you can tell who on the Senate and House side represents your district, and then you can look at neighboring districts and across the state. We'll have a map of the Capitol so you don't feel like you're getting lost. It's a confusing building. And then for those moments where you might not know the answer or you might have a follow-up, we'll prepare a sheet where you can kind of jot those down and be able to follow up after. So what you should prepare in the next couple weeks or have ready, the biggest thing are stories, as Laura mentioned. So really thinking through the positive impacts that your health center has had for patients, the positive impact you've seen when children have been covered, how coverage has helped in prevention and access to more services, and how gaining Medicaid coverage has helped your patients. So we're really looking for those anecdotes that kind of we at the OPCA level don't necessarily know and that your legislators will really want to hear more about. The data, so we'll have data on the district level fact sheets, but if you want to pull together some data or want to be able to kind of pinpoint exact numbers, that's helpful too. So some helpful areas to potentially pull are number of patients that you see, where your clinic locations are, patient demographics, if those are easy to access, the number of staff that you employ, and then examples of how your health center is improving care. And if you have any fact sheets, I know some health centers have developed their own fact sheets or kind of informational pieces. Those are helpful to bring as well. Not necessary, but if you have them, bring them along. So again, logistically, we'll be on the 3rd floor in room 350. Arrive at 8 on March 21st for breakfast. Coffee, lunch, and snacks will be provided throughout the day. We'll wrap up. We'll start wrapping up around 4:45, so 5 o'clock we plan to kind of start clearing out of the room. But that room we have all day, so feel free to come and go. You can kind of plunk down, and we'll have, I think, 9 OPCA staff there to kind of help coordinate and answer questions for you as well. All right, so next steps, collect those stories. Let us know if you have any questions in the meantime about stories or anything you think might be useful and want to bounce off of us. And then lastly, we're going to be closing registration tomorrow, end of day. So if you have had any additional folks who want to attend or you realize you can't make it for any disappointing reason, let us know and we'll be sure to change that. All right. So now we'll go ahead and unmute you if anyone has questions.
Yeah, hi, this is John Duke, and I'm wondering, you know, the stuff we're putting forward here to talk about is how valuable health centers are and how valuable our health centers are in each particular district. What we're not talking about in here is specific bills other than the Cover All Kids bill. And we're not talking about strategies or specific encouragements around filling the budget hole with new revenue and encouraging people to find new revenue. Is that a direction you want us to go, and should we know some about that?
Great, that's an excellent question, John. Yeah, so the intention is actually for that second piece, which is prevent any cuts to the Oregon Health Plan, is exactly about the budget. So there's sort of ever-changing conversations about the budget, fast and furious, but there isn't sort of a specific thing other than fill that budget hole, explore all revenue options that you can, fill that budget hole, and do not cut access to care for patients. So that is exactly what that's intended to be. And we'll put a little finer point on that just to make sure that's crystal clear in the talking points that we have at the day. But yeah, the intention is we've got a huge budget shortfall. Please do everything you can to fill that shortfall and protect Oregon Health Plan patients from any kind of cuts. That's the exact piece. And because that is just so critically important, those are the big sections we have. There may be a couple other bills that come up that will pop into the talking points, but and then those are also listed on the overall fact sheet. But those are really the big ones: is protecting the Medicaid budget, finding that revenue, and covering all kids.
Hey, Laura,
thanks for bringing that up. Sorry, that was unclear.
Laura, this is Ron Jelm. Is part of those talking points, or part of those talking points in any way talking to our state legislators about anything going on in Washington at the time and how they might weigh in to the Washington conversation?
Yeah, that's a great question. So I think it's interesting. When you're in Salem, people are mostly focused on what they can actually, what's in their sphere of influence, right, in Oregon. So most of the conversation with lawmakers is about what's facing Oregon. How are we going to fill this budget hole? How are we going to move through the session, knowing that if things change coming out of from a federal standpoint on Medicaid, much of that will be conversations that actually happen after the session, in a special session or in future years. That said, it comes up. It's sort of the air, it's the water we swim in. So it's sort of everywhere, and it's really natural for it to come up. One thing that we'll be looking forward to following up with legislators on after these meetings is asking them to send a letter to Oregon's delegation, urging them to not hurt Medicaid and to protect health centers and health center patients. And so if something comes up like that, I think there'll be a great point to say, if a lawmaker asks about the federal, say, absolutely, we have really big concerns about the conversation in the federal government, and we would love to ask for your help in protecting health centers and the patients we serve. As part of that, we'd love to follow up with a letter you could send to the Oregon delegation. So I think there's some piece of that, but it's surprising when you're in Salem how much people focus on the task right in front of them. And then, yeah, sometimes it comes up. That's an excellent question. Thank you.
Hey, Laura, this is Gil. Sorry I joined late, so you may have already covered this, but are we taking any positions on revenue-generating measures, and are we talking at all about, Medicaid and how presumably, if federal dollars still stay, that the leveraging of federal dollars to state revenues and the impact of, if we make big cuts at the state level, then there's also a reduction of federal dollars.
Right. I think that talking point is definitely happening, in Salem all the time. I think the most important thing for lawmakers to hear from you when they're in the building is that those stories and those examples of what is at stake. The real examples of how health centers are helping Medicaid patients get healthier, and that's and how important that's been. I think that's really the value add. A lot of the larger those pieces are happening. In terms of specific revenue pieces, mainly our strongest point is saying we need to explore all options for revenue and fill that revenue hole and protect, and one of the main reasons to do that is so that you don't hurt some of the most vulnerable people in Oregon who are on the Oregon Health Plan. That's sort of our best thing. People are hearing all the time. Conversations about revenue are happening all the time. It's a constantly shifting. Different ideas are getting thrown all over, and a lot of those conversations, frankly, are behind closed doors. And we have some ability to get in those rooms through different venues. The most important thing for lawmakers to hear from you is here's what will happen. Here's why you need to fill that hole. Let me tell you what's happening in our district and what we have to lose if we end up cutting people off the Oregon Health Plan, or we end up cutting access to care. So that I think is the real strength to bring. But that absolutely, do everything you can to find revenue. We aren't really the revenue experts. We're certainly in those worlds, but health centers have such a strong story to tell of why we need to fill that budget hole with maybe 15 minutes with a legislator. That's the best thing to focus on.
Mm-hmm. And if we're asked to weigh in on various tax kind of proposals, we just tell them that we're going to get back to them on that, or that's where we look to OPCA to guide the conversation.
Yeah, and I think it's going to be much later in session. It's going to be a larger package, and I would be, I think they'll go, would you, what do you think about the provider tax, or what do you think about these? It's like we need to look at everything we can. All we know is we just can't cut this. So
got it.
That's what I would urge, because it's just changing constantly, and there's a lot of conversations. The main things are, some pieces are around reinstating the CCO tax or the MCO tax and a tax on insurers. Another piece is creating a true hospital tax. Another piece is creating basically a gross receipts tax, something sort of the thing that replaces the fact that Measure 97 didn't pass. And so there's conversations about all of those. Everything is in flux. There's a lot of details. Lawmakers hear from wonky people in that every day of the week, every hour of every day, and what they don't hear all the time is what's at stake. What's the beautiful thing that they're going to destroy if they don't fill that hole? Yeah, the less that we're saying wonky things about a gross receipts tax, the better. It's like the business community and the labor community in a closed room fighting it out. We'll see what happens.
Mm-hmm.
Yeah.
This is Ann Barr Gillespie. I want to shift gears just a little bit. And in terms of telling the stories through other nonprofit organizations that I'm involved with, I might be able to have information that might enhance the story. Like, for example, knowing what clients served by other nonprofits that provide housing assistance or rent assistance, how those clients are experiencing the changes in healthcare in a positive way. Do you think it dilutes the stories at all to bring up, what we know in sort of a broader context? Should we stay focused on the healthcare piece, or tell a broader story when we're talking to legislators?
I think the broader story is fantastic. It's a lot of what lawmakers are interested in. Is we know we need to address the social determinants of health. We know that health doesn't happen in a vacuum. There's housing, there's food, there's trauma, there's all sorts of things that influence health, and how those things intersect is something that they look at, and I think examples in there are really great.
Thank you.
I would encourage you to send those examples to us if you feel comfortable with it in writing as well. I mean, we can talk through how to share those bigger stories beyond that 15-minute space you'll have too. But those are powerful.
Okay, great.
Yeah, really great.
Hey, another issue that, of course, we're dealing with a lot is on the immigration side of things, and I know that's a little bit outside of the main purview, but very related to the work that the health centers are doing. How much should we be talking about that, and just in terms of in encouraging Oregon to maintain, its existing laws, with respect to, local law enforcement and immigration, stuff like that.
Right. I think given the limited time we have with lawmakers and the really key piece on the issues we have, yeah, and then just the limited amount of Oregon, like that, those things are not really up in the Oregon legislature. There aren't vehicles. It's not something that lawmakers are weighing in on necessarily as lawmakers. And then just given the makeup of both houses and the governor, it's just not, I wouldn't put the effort there. I think there may be efforts that you might individually connect with lawmakers separately if there's a specific thing. But I think, yeah, I think that would be my gut on that piece.
Okay, good.
This is John again. In the discussion around the protection of Medicaid, I just want to be clear where it's at, because I'm not totally on top of the mechanics. So we are about to switch into a period this year where the 100% coverage of the expansion population drops down to 90% coverage. And so there's a 10% coverage that the state has to come up with. And that is the part around protection of Medicaid that we are trying to protect. Is that correct?
I think, well, see, there are a number of pieces that caused there's a couple of different pieces causing the amount of federal dollars that go to Oregon's Medicaid program to go down a little bit. And one of them is that the ACA expansion population is in the process, and it's not going just 10% all at once. It kind of goes gradually down to 90% over a period of time. But we're hitting around, I think, around 94 this biennium. So that's one component of it. The match rate is also for the the core part of Medicaid is also reducing. There's also we no longer have those transformation funds. So there's a number of different pieces that are part of that. So that's one section of it. And then in the reality is in terms of the general fund for Oregon, it ends up being just all one budget. So we're trying to fill the healthcare budget as much as possible with changing how taxes, provider taxes and MCO taxes, those kinds of assessments that are within the healthcare industry. So, but I don't think we need to get too much into the details of that. Simply to know, it's not that we have runaway spending in the Medicaid program. It's down because transformation has been quite successful in reining in ER usage and other pieces. So the spending is actually pretty level, and then it's just this other component. Yeah, I think that's the main piece to know there.
Well, the thing I was thinking of is this talking point worth talking about is, instead of talking about this Medicaid hole to fill, be talking about the fact that every dollar we put into it from the state gets more than a 9-to-1 match from the feds for Medicaid. And that is an important and valuable resource to pull into Oregon, that we can really leverage our state funds by doing that.
Yeah, I think that's a general piece that is useful, and that's where those particular provider and hospital and MCO assessments are useful, is that because they actually go toward the match. I think that's useful. We want to maximize the amount that we're drawing down federal funds to match those pieces, and it's there's the expansion population, there's the non-expansion population, there's different pieces. I don't think I think it's one talking point. Most lawmakers are pretty aware of it. So I think I would, in terms of emphasis, focus on the other pieces. But it is good to know. Yeah. the way Medicaid is currently, there is a substantial match when Oregon puts money forward. And as noted, how Medicaid works might be changing, so, but we don't know details about that yet.
Hey, Laura, this is Greg Miller. Understanding we don't have a lot of details in terms of what the Human Services budget looks like, only that they're looking at drastic overall cuts to it. Where does the alternative payment methodology rank in terms of really thinking about a couple bullet points that are valuable to us as a group if we are asked about specific programs within the Medicaid budget? Should we stay away from that or be prepared for that, or what are your thoughts on the alternative payment methodology?
It's on our list of priorities. It's something that we've met with the leadership and members of Ways and Means on. It's included in the proposed governor's budget. It's just woven right into it. But we have highlighted it just because it's not a controversial piece. I think what I would say is that for members for legislators of yours that actually serve on Ways and Means or on the Ways and Means Human Services Subcommittee, and we'll have a list of where they are, who those are, is actually just sharing with them, if you have a story about how your health center is looking forward to becoming part of the alternative payment methodology, or it's a part of APCM, or if you're already part of that, what it's helped make possible. I think if there's a brief story about that kind of improved patient-centered care, that can be a helpful piece. And it's a really wonky thing where it's basically just it's a budget fix that moves money from it's budget neutral, but it moves money from the next biennium into the the future one. It's just so it's a kind of a little wonky thing. I think we can include some brief language in case that comes up, but I would be surprised if it does.
Okay, I was just concerned that legislators could latch onto that as a program and start taking whacks at that. If they have some information or background on why it's valuable, I didn't know if that would help ease that. Yeah,
I think it's more like it's not really a separate program in the piece. It's woven into just it's just more of a accounting fix having to do with the budget. So I wouldn't worry too much about that, but I think it's never bad to tell them a good story about something.
Yep, I hear you. Thank you.
Yep. These are great questions. These are just going to make our talking points stronger. So if you have questions, things that are coming up, this is actually really helpful. No one has asked a question about parking yet, and that's the easiest one to answer. So I'm just going to go ahead on that one. So Oregon's logistical piece, but Oregon, it always has been really challenging to park around the state capitol, because basically what you had to do was park and then put a quarter in and then run down to the basement and get a parking pass for a whopping $15, and then run back out before your quarter was done, or your nickel, and throw it on your rearview mirror, and after filling it out. And now the Capitol has meters, 10-hour parking meters. You can just use a credit card or cash or whatever, and you can get the number of hours you want, and you're done. So it's about the easiest thing in the world, and you can find even cheaper parking in the yellow lot. We can send out some info about that, but it's a very easy place to park nowadays. There aren't more spaces, so that's challenging, but if people are getting there at 8, it shouldn't be too much of a problem. Just want to mention parking's easier. If only everything was as easy as parking near the Capitol now, we'd be in spades.
There still aren't that many spots.
Yeah, there are not more spots. Unless you have an electric car, in which case there's special spots for you.
More incentives to get there early.
Yeah, exactly. What other questions do folks have?
Do you guys know can you hear me?
Yeah.
In Oregon, like I said this, I was on a national call the other day, and they were talking about the Medicaid budget, and they said in most states, the medical part of the Medicaid budget is dwarfed by the long-term care portion of the Medicaid budget. And pardon me, as we look at Oregon Health Plan, and I probably should know this by now, but is OHP include both of those components, or are they bifurcated here? Can you help me understand that better?
Yep. So in Oregon's, in the Medicaid budget, the largest component is the long-term care. It's not the most people that are served by that, but because of the the intensity of services, it is one of the biggest components.
So that's a part of the deficit. It's not just primary care and hospitals and specialty medicine. It's when we talk about OHP is a big part of the state's deficit challenge, we're actually a smaller portion of the OHP budget.
Yeah, and specifically, health centers are probably more about 3% of the budget. So it's a very tiny. You get a good bang for your buck with community health centers. It's a tiny part of the budget, but it's a lot of the people, right? So health centers serve 1 in 4 patients on the Oregon Health Plan. So it's a good piece. And there is an existing long-term care tax that helps fund Medicaid overall. So it's both a considerable expense, but also a considerable source of revenue.
All right.
So those are the two types of provider taxes that exist in Oregon right now, are the hospital and long-term care.
The other thing I wanted to ask about is, have we ever done work on, so one of the things we've noticed is, especially with our expansion population, that there's a significant amount of addiction, just as an example. And so, and I don't have global data on this, nor do I have any kind of detailed data. I'm not even sure how I would get this, but I have a couple of stories that I know of specifically where they got on Medicaid, they got in, we got them on to medication-assisted therapy. They were able to kind of get their, have a connection to primary care. They got their life back together, and instead of, couch surfing, stealing, threat, kind of going to jail and costing even more money, these people got back, recreated or reconnected relationships, got a job, making a living, renting an apartment, and they really got their lives back together. And we're able to have that kind of impact. Have we ever done any work or studies around, because people get on OHP, they're able to get back to work faster, there's more income that's earned, gets them actually off of the OHP at some point, and the positive impact on the budget that kind of activity has, that enabling activity.
Yeah, I think there is some, we have not done it, I think there is some effort even to capture just literally when you get people covered, they are able to, instead of paying a lot for coverage, they can, they can earn more money, and that there's it pays for itself in terms of additional revenues to the state. I think what you're talking about is just an incredibly powerful story, not just in terms of how that helps that patient's life, but it's not only it does all the things that you said. So I think I don't know about who's doing a study on that piece, but I think that's where anecdotes are really powerful. It's great.
I guess, I think it's, well, okay.
Yeah, we can look around and see how we could quantify that.
I think that the important thing on stories like that also is the holistic approach to the services at a health center, so that we're coordinating care across primary care, mental health, addictions, and other social services.
Yep, not only the effect it has, but really the strategy of coordinating that's making that impact. That's great. That's great. I think those stories can be told in oral health as well. It's seen some great stories come from you all about the impact of oral health and being able to get dentures and feeling confident enough to go look for a job, and what an incredible difference that can make for patients' lives, and also, you know, probably has a really big net benefit for the state budget too. Cool.
Any other questions before we wrap up?
Will you be able to send us, Laura, will you be able to send us the schedule of who will be meeting with what legislators for that day, or will that be something that will be made up that very day? It's so changing.
That's a good question. It does help to know what you can expect. I feel like it would be possible for us to get that out to folks ahead of time and just know that sometimes literally something changes that, you know, late that Friday or that Monday. So things can change, but we can send out, you know, our best that we've got. That would be helpful.
Yeah.
Yeah. We've got a lot of them set. You know, it's the legislature, so anything can happen. So you kind of have to be ready for that, as you all are experts at. That's a great idea. The more that can be in advance is the better. I would imagine the same thing with talking points too.
I was going to say, I can send out the sort of the packet of materials that we'll also have printed with the recognition that the legislative meetings and the agenda may change slightly day of, but we can send those out. And there was a question about the slides as well. This webinar has been recorded, so we'll send it out so you can share it with anyone who wasn't able to attend today.
And we'll also provide slides so you can do it one way or the other, get that information.
Great. Really looking forward to this. It's a great time for a lot of people to come to Salem, and even though it's an incredibly challenging session, I feel like it's a great time to be coming into the session and telling lawmakers about the excellent work that you're doing and the importance of the programs that help your patients.
Right.
All right. Thanks, everybody.
Thanks, everybody.
Thank you. Thank you all.
Right.